Hi. So today I'm going to talk about a new innovative instrument used in the treatment of Peyronie's disease, which is not at launch, but it was gifted to me by the Rigicon company during my visit to Porto for the World Meeting of Sexual Medicine. So this was a innovative instrument which the company has told that they had not might be in the whole world they would have given to around less than 100 of the surgeons might be using these instruments. So let I will explain you how this instrument and how it works and how it helps us in the treatment of peyronie's and plaque incision and excision. So before that, I would like to tell you that I never support any specific brands of implants because every person coming here would have a different opinion about different implants. Some people would like to go for a very hard implant. So usually those people might go for this Tactra malleable implant by the Boston Scientifics. Some people would like a natural feeling penile implant. So they might go for this Rigicon or Promodon, or they might even go for this inflatable options. So these are the options. Some would like to have a very good concealable implant. They will go for this Promodon implant, which has a very good concealability. So these are the different options. Some would like a Swiss implant, so they might go for the ZS800, and it has a good advantage. We can trim on both sides. So these are the implants, and some would like to go for a very cost-effective and effective implant. Say they go for this Indian Shaw implant. So now let me show you the package which we had received. So this is the package we had received from the Rigicon. So these instruments are called as dilators with cavernotors. So what it does, it helps in the dilatation and it helps us to incise and excise the plaques of the Peyronie's disease. So usually we do the plaque incision and excision separately. Many people had asked us, why doctor you are not showing the video of the plaque incision and excision? Because of this because of the many norms, we can't show much blood or much into the surgical content. So we show you before and during and just after the procedure, so that everyone can view this and it doesn't give a full bloody video or something like that. So that's the reason we don't show exactly everything which we are doing, but we try to show the important things so that you will also be able to understand, and the people who also want to learn from us, they can also learn, because that the steps which we are showing might be the most important steps on the penile implants. So I will show you. So these are called as the cavernotors. So you can see this just I'm showing you one of the instruments. So they had given five things for me. So different sizes starting from 6, 7 up to 14. So I'm showing the biggest thing. So it helps in the, you can see the measurements over here. The measurements are made from 5 to 20 and 6 to 20, and these are the normal dilators. So if we use this instrument straightly, it will act as a dilator. But when it acts as a cavernotome, when I am rotating the instrument. So you can see the blades over here. So these are the blades. When you observe minutely, each side has around 3 blades. So when I rotate the instrument, it incises the fibrous tissue. So what is the advantage? When the fibrosis, the incision will be placed over here, if the fibrosis is at this point of time, this instrument helps us to handle the surgery in a much easier way. So I had seen a lot of cavernotomes in the market, and I had also used a lot of cavernotomes, and even we had tried a lot of different methods, our own innovated methods, and the methods from our friends, because treating a Peyronie's, like a surgery in a Peyronie's plaque, especially a severe Peyronie's plaque with curvature and placing an implant, is not as easy as we think, because in the end the patient and the doctor never wants any complications. So they want the implant to be placed properly, and even I also want to do that, because they had trusted here and they had come here for the surgery expecting a good result so that they'll be able to have a good sexual life. So we had tried a lot of innovations, like not only here in Madrid, everywhere. Every doctor try a different thing so that the results should be accurate, because none of the penile implant surgeons would want their patient to suffer or have an infection or lose much of the length, because in the end, when the patient is satisfied, that's what it gives the happiness to the doctor who is treating them. A patient going back home happily, it gives a pleasure. Okay, we had done the job which we had expected and come here. So this is one of the kind of instrument which helps us to achieve that. This company had given us this, and they had told us they had given it to a very few doctors all over the world, might be less than 100. So the company, what they told us, for every doctor we are giving, so we are embedding their name on the instrument, because it is not much doctors they are using this. So you can see they had embedded the name in this instrument. So it gives the uniqueness of this instrument. It is not for sale. It is only for their privileged doctors or the doctors who are doing a large number of penile implants. They are providing this instrument. So I also was very happy. The company recognized us as one of their privileged doctors. So they gave it to me in this Porto, in this conference at Porto. So I was also really happy. So all the sizes they had given, this is the smallest of all, and this is the biggest. So I can use this instrument for incision and excision of the plaque, for dilatation, and for measurement. So all the three things can be done with the help of one instrument. So this is a good thing. So I had used these instruments for the last 3 to 4 cases we had used. It was really good. So now I am giving the video because I want to explain what is this new instrument, and it's a real innovation. So actually, there is I think tomorrow we are going to have a very tough Pyronis case. So I will be showing you in the video how I am going to use that instrument. So the patient has a almost 90-degree curvature. So we are going to expect a good result for them because the patient has trusted us and he's coming. So we are hoping to get the best for them. So just I want to let you people know and share my happiness about the new instrument, and want you to understand Peyronie's disease is not the end of the situation. It is treatable, and even in Peyronie's disease, you don't lose much length when you have the proper instruments and the proper procedure. When it is done, you don't lose much of the length, and your length can be maintained. So thank you for watching us.